Hey, good morning, everybody. Can everyone hear me?
Good morning. Yes, we
Yes.
can.
Yes. All right,
morning.
just checking. Nice to see you all. We are going to begin in just a few minutes. So we'll just give it just a few minutes. The agenda, thankfully, is not as packed as it was the first meeting. So we'll have a little bit of time. Happy almost Halloween and fall. It is very fall-like outside. It's pretty nice out, I'm not gonna lie. All right. Assemblywoman Munoz is running a few minutes behind schedule, so she's running a little bit behind, but that's okay. I think Assemblywoman Murphy joined. Assemblywoman, are you with us?
Yes, I'm sorry, I had my mic off. Yes, I'm here.
Hi, how are you?
Good, how are you?
I'm good, thank you.
Please forgive me, I am leaving my computer screen off as much as necessary because I'm having some internet issues and I don't want us to lose connection.
No problem at all. Thank you. I'm just gonna give it 2 more minutes. And then we'll at least start. I can always forego my opening remarks since y'all know who I am, and so I can always forego that. It was only gonna be a minute anyway, but still, I'm happy to forego that.
Me as well, Nancy. No problem.
Thanks. Hi, Senator Johnson. I think I saw you join. Can you let us know if you can hear me? Senator Johnson?
Nancy, Assemblywoman Spate is on.
Oh, I didn't even, oh, thank you, Sal. Hi, Assemblywoman.
Good morning, everybody. How are you?
How are you?
Great. I'm just joining.
Awesome. Thank you. All right. Well, as Senator Johnson fixes, I think, his microphone issue, I just emailed Senator Bucco to remind him to join. Assemblywoman Munoz is going to be a few minutes late. So it's already 11:06. Assemblywoman, I will probably start just so we could try to keep ourselves on time. Again, thank you for joining the Home Care Caucus. We very much appreciate all the people on the call and our esteemed legislators who have joined the caucus and our co-chairs as well. We have had a few meetings already of the caucus, even though it just started in June. Our first meeting was on June 10th in person in the State House. We then had a Zoom meeting on September 24th. And this is really just the finishing of the agenda of the September 24th meeting. So again, my name is Nancy Fitterer. I run the Home Care and Hospice Association. Thank you all so much for being here. I'll let Andrea introduce herself, and then I think we'll just start on our agenda. Thank you.
Good morning, everyone. My name is Andrea Sussman, and I'm honored to be here again representing the Home Care Association of America, New Jersey chapter, where I serve as the chapter chair. And I just want to extend everybody a warm welcome and thank you for attending this continuation of the last meeting. It's definitely a privilege to come together once again to continue these discussions on key issues. Today, we'll be discussing the Domestic Workers Bill of Rights and the proposed financial reporting rules for healthcare service firms. And your continued commitment and to really understanding what the challenges and opportunities associated with these policies is really invaluable. So thanks once again for your presence, insights, dedication, and especially for your willingness to drive positive change.
Thank you, Andrea. And I just saw Senator Johnson's office joined. Hi, how are you? All right. Do the co-chairs or any legislators want to speak or give any welcoming remarks before we jump into our meeting agenda?
Yeah, hi, this is Assemblywoman Carol Murphy. First of all, it's great to be here, and I'm glad we're continuing this. And I have to just let you know that 2 weeks from now, 3 weeks from now, I guess I'm losing track of time, I'm going to a conference, an annual conference in Atlanta, and I might have said this the last time, with my National Foundation for Women Legislators. And I'm going to bring up the fact that we are doing this here and letting them know exactly how well this is going. And hopefully we can stimulate even more home caucuses around the United States with many of these legislators, because they're all women. They are people who are very health conscious, and we're constantly talking about these health issues that matter most and impact our families. So I just wanted you guys to be aware of that. So I will let you guys know how that goes.
Oh, that's amazing, Assemblywoman. That is absolutely amazing. Thank you. Thank you. Anybody else want to give opening remarks before we start?
Good morning. This is Assemblywoman Spade. I just want to say thank you so much for being here. Thank you for having this caucus. As the chair of Aging and Human Services, we've been doing work, just trying to see how we can make our state better when it comes to home care. So I'm always here and available if you need any assistance from me when it comes to legislation, whatever we need to do. I'm here to help. Thank you so much for being here, having us on today. Thank you.
Thank you. And I just saw Assemblywoman Munoz is joining us. All right. And Senator Johnson's. All right, wonderful. Thank you so much. As I let them get settled they are more than welcome, our co-chairs or any other legislator, to give opening remarks. But in the meantime, I'm going to dive right into our agenda. First and foremost is Discussing something that is a priority to some of our agencies, and I'm just going to give the briefest of backgrounds. So home care is very varied. We fall under a couple different umbrellas. The first would be our Medicare certified home health agencies that fall under the Department of Health. The second would be hospices that also fall under the Department of Health. The third and largest group is something called healthcare service firms. So a lot of the agencies here are healthcare service firms, or are the other two that I talked about, and may also have a healthcare service firm license. So healthcare service firms are regulated by the Division of Consumer Affairs. I only give this little bit of background because this piece of legislation only affects that group, but it is a very, very large group. Last time I checked with Consumer Affairs, we had about 1,100 healthcare service firms in the state of New Jersey. With that said, I am handing it over to Sal, who will give a little bit of background for us.
Thanks, Nancy. 1,100 firms. So that's really a good launching point to talk about this particular law. So speaking to the members of the legislature who are here, so the healthcare service firm financial statement audit and report law was signed into law in December of 2020. So coming up on 4 years ago. Under this law, there's a tiered system of financial statements that are applicable to various healthcare service firms. And this law amended a law that was at that time about 5 or 6 years old that also required healthcare service firms to be accredited. As Nancy mentioned, the department, or the division, I should say, of Consumer Affairs finally promulgated regulations in May of 2024. So 3.5 years after the law was passed, many of the companies in this meeting submitted comments and concerns about the proposed regulations. They were due in July. So we're 3 months later now. In October, towards the end of October, we don't have regulations yet in place, but we expect them maybe in the spring, according to some of our discussions with the Division of Consumer Affairs. So this law requires a multi-tiered mandate for different firms depending on their size and their payer mix. So, for example, firms that make $10 million or more in the aggregate have to submit an audit. Firms that make $250,000 or more in Medicaid funds have to submit an audit. And firms that are in this middle bucket only have to submit a report. All of the firms have to submit a financial statement, and the law tries to align the timing of these financial requirements with renewal. Each year's the firms have to submit renewals. So what you have at the end of the day is really a lot of duplicative information. For example, the statement, the financial statement, which is, ostensibly the least burdensome requirement, simply requires a listing of the firm's assets, liabilities, gross income, etc. Obviously, an audit is much, much more exacting, and a report similarly is somewhere in the middle where a company has to provide a portion of financial data that's prepared by a certified public accountant. And then there's also a compliance component. All this to say, it is somewhat overlapping to a large degree. It requires something more in terms of financial reporting to every company out of the 1,100. And between us chickens on this meeting, we know that the Division of Consumer Affairs is not possibly going to be reading 1,100 financial statements and audits or reports. We understand that there's a purpose in reporting, and that's to make sure that public dollars are being used appropriately. But we kind of want to submit to the members today that this is a pretty complicated and burdensome obligation for all of these companies who have to submit at minimum something more. There's confusion, right? Number of the members have gone out to talk to CPA firms. The feedback from the CPA firms, most of whom don't even feel that they have the healthcare experience with this such a regulated entity as a home care service firm, that they're not sure they could even promulgate like a meaningful opinion. You know how accountants are. They're in some ways more difficult than lawyers in terms of providing, an opinion, a meaningful professional opinion. The costs that have been quoted to some of our companies are between $15,000 and $30,000. And that it's difficult to facilitate an audit for submission for 1 year if you haven't constantly audited in the past, because there's not necessarily, if you skip years, there's not a baseline from which to start your audit. So some complications. When we've talked to the sponsor of the bill several months ago, I think we met with Senator Poe over the summer about this bill. Her feedback was that during the course of the drafting of this back in 2020, the Attorney General's advice was that all firms had to have some degree of accountability here in terms of financial reporting, and that's why even smaller firms were tasked with providing some submission. Unfortunately, now that we've had months to digest these regulations and the law, most of the items required in the report are already submitted with the annual renewal that's submitted to DCA and or reviewed by an accrediting body, because all of the healthcare service firms need to be accredited. The report, therefore, we conclude is redundant and unnecessary and probably unlikely to be reviewed by DCA. The difficulty in finding an independent CPA firm has already been discussed. And then essentially just a reminder, right, that as Nancy said, there are different types of firms in our organization, but the largest segment are small independent businesses. The irony when we're talking about policy that wants to ensure financial viability is that when firms might be struggling with financial viability, the additional costs and obligations of providing an audit, ironically, just exacerbates the financial problems that any firm might be dealing with, even those that don't get a significant amount of public dollars
to that route
through their payer mix. So with that, we just wanted to ask, and it's sort of a high level overview, we wanted to ask for your consideration in perhaps revisiting this law, maybe weighing in with the Division of Consumer Affairs in terms of lightening the load to the degree they can with their regulatory authority. And of course, we also have, I think, a CPA on the firm, Brian's here, who might be able to provide from a professional CPA perspective some of the challenges they would have in helping the member companies comply. So with that, Nancy, I'll pass it back to you or to Andrea for the next speaker.
Perfect. And the only other thing I'd say is we have already reached out to the Division of Consumer Affairs, so we would not bring this to the caucus's attention. We've reached out to the Division of Consumer Affairs. We are meeting with them. We were supposed to have a meeting scheduled with the acting director, but she was busy being confirmed as the director, so it got pushed off. So it is next week. So we have a variety of things that we want to talk to her about. Some of it is under her purview to be able to change, but unfortunately, like the due date of the audit itself, but other things she wouldn't be able to change because again, it was passed into law. So, but we will of course update you at our next Home Care Caucus meeting about it. But again, I think there are certain things that she would not be able to change whether she agreed with us or not, because it's now passed into law. But without further ado, trying to keep us on track, Brian, thank you so much for joining us. If you want to go ahead.
Sure. I love some of the opening remarks from Sal, and you're entirely right. Accountants are a very strange brew of people as well. And yeah, we do sometimes make mountains out of molehills, but one of the underpinnings to what we've been saying all along. Even when Senator Poe initially introduced this into law, I I really do understand the position that the state's trying to get to, which is, following where their resources are going and what we're doing with those resources. Yet I think that law initially ignored some of the questions that were underlying to a lot of these organizations, which is they may not be receiving any of these funds in any way, shape, or form. So how can we expect them to do or be part of writing reports that they're not really receiving any of these funds? And yeah, home care, I've been working with home care agencies for, the better part of my career, which let's just say for argument's sake is over 30 years. And yeah, there's definitely some extensive reporting requirements that I've worked with agencies throughout the country. So, cost reports related to any type of healthcare entity definitely ask more extensive work, but at the same time, it does add more cost to an agency. I do want to address some of the points that Sal had brought up, which is, yeah, when some of these entities, um, if you have a gap in time from one reporting period to another, it definitely makes our work more challenging because how do we know if anything was adjusted or amended in those earlier years? So you start to lose that continuity year over year, and therefore becomes even more exhausting of work for us as accountants to do. I think the way that the law is currently written, it definitely leaves some room for accounting firms to sort of, portray what they want to do, how they want to do it, and that could look very different from firm to firm. And I think if there was some more granular design behind what you folks are looking for, I think that would go a long way. And I think, because I've been watching this law for a very long time, I mean, I can certainly help craft something because I do understand from a legislative standpoint, you want to know where your money's going. And I think there are a lot more, what's the word I want to use? I think there are much better ways of following the money if we design procedures to follow that money so you can see exactly where it goes. And I think the tiered approach, I think, is absolutely appropriate. I think for folks that are receiving very little funding, yeah, we just want to see that you're using those funds appropriately. Somewhere in the middle bucket, I think you have to do a little bit more work. And folks that are much larger, then yeah, I think that they do need an audit, and there are other additional steps that we could do. But I think that's a totally different strata of organizations that we're talking about. And yeah, cost is definitely a factor. And, when you think about lawyers, forgive me if I have lawyers on the phone, but, when you think about a lawyer, they're always on the clock and they're always, hey, by the way, I spent 15 minutes, I'm going to send you a bill. Accountants sort of work on our independent opinion. So every time we go to sign an independent opinion for anyone, there's a cost associated with that. And the level of work related to that opinion definitely changes depending upon the amount of work we have to do. So the smaller entities, if we're just looking at very specific procedures, sure, we can reduce the cost significantly. When you get to that middle tier of organizations, yeah, there's a level of work that will increase the level of work that we need to do in order to sign that opinion to give you folks comfort. So again, the cost should be, from a tiered approach, it'll definitely go up. And folks that are over that $10 million mark, I think that's a different bucket, and we can address that at a later time. But I would imagine those folks should be getting audited financial statements anyway, depending upon their industry as well. Is there a question out there? Sorry, I heard someone.
This is Gordon Johnson, this Senator Johnson. I just had it sounds like to me, and I'm sorry I jumped on like had problems getting on, but anyway, it sounds like to me that I should be hearing from Sal and from Brian. Sal should probably send like a draft bill, so to speak, to correct this. It also sounds like this bill was put through without your input with your industry. Unfortunately, your input wasn't accepted. And maybe I'm kind of guessing that that's what happened. So we could fix that now if that's what you want. I support the idea of fixing that. I don't see how we could require these small businesses to pay $8,000, $9,000, $10,000 for a report. That's probably not going to be read by the department anyway. So, Sal, that sound good to you, Sal?
Yeah, I appreciate that, Senator. Brian and I could put our heads together and tweak it. Again, we're not trying to be, avoid liability here in any way, but even some of the companies that don't get public funds are covered by this requirement, which again just seems duplicative and a little burdensome. So we'll lay that out for you. Appreciate that.
To me, it was done without much input from the industry, which whenever I do a bill, I want to hear from the what they call the SMEs, the subject matter experts. That'd be you guys in this case. So I support that idea of if you want to submit some legislation or a call to the department, the responsible department, if you want that, we could do that, or both. You tell me what you want to do.
Senator, if I may,
yes.
One of the things that would be very important to me before I go down that path, and I really do appreciate your input like that, I'd want to know specifically what you folks are looking to see from us. Because to me, I get that you want to see that money, but what's the most important feature that you want included in these procedures that we would do? Because I want to draft it so that at the end of the day, it lands on what you folks are looking for.
Exactly. Very good. And I'll get back to you with that. Now I'll speak to the sponsor, prime sponsor on this, and to find out where she is with this before she takes off. And
if I'm sitting in your shoes, forgive me if I just interrupted you, but if I'm sitting in your shoes and I'm giving someone $1 million, I want to know where that went. Did it spend right? Did it spend correctly? Did it go for what we intended it to be used for?
Right.
And I think there are much more efficient ways to get to that answer if we just sort of look at the procedures together.
And I don't like hurting small businesses or putting up their way. I just with regulation or so I have a problem with that a lot. But anyway, I'm sorry.
Thank you.
This is Assemblywoman Carol.
Yes.
I'm sorry, but in Senator and Brian and Sal, of course, as a co-chair, I will be more than happy to do whatever the senator does on the Senate side in the Assembly, so we can move this together in both houses.
Grateful for that. Thank you.
Thank you so much, Assemblywoman. Thank you. Assemblywoman.
I agree with that. Yeah,
Thank
I was just saying the same thing. Obviously, all of us, we often talk about the unintended consequences of pieces of legislation, and this is why this caucus is so important, because we're learning about things that have unintended consequences, and as we know, we can fix these things if we know about them.
Thank you so much. Yeah, we can lay it all out for you. So we'll lay out all of the kind of unintended consequences and our concerns with them, and happy to share them with you, and we'll work with Brian on that.
Okay, you got the team here.
Amazing.
Yeah, love that. I'd love to share around what I would envision as, intended or agreed upon procedures that the smaller entities would have to embark on, and make sure that they're not too onerous. But I think if in the legislation they were sort of more clearly defined, then any accountant could do it if they just, pulled it right from the regulation.
Good.
Great. Okay. Well, we have two providers that we're going to speak on this. I don't know. I mean, I think you guys are willing to listen to our concerns. So, Todd, if you wanted to just give as quick as humanly possible, just maybe just from your point of view, what that looks like. And you are Preferred Home Health is a larger firm, so they do get audited anyway. But just so you kind of understand the landscape, if you would indulge us.
Of course. So I am a CPA. My father is a CPA. We were both offended by Sal's earlier comments about how annoying it can be. No, well said and well covered. I think the only thing for this audience, and again, we can put this in the draft, is extending the deadline. The reality is having a June 30th deadline becomes very difficult. So Brian and anybody within the auditing committee, in the community rather, Your first quarter of the year gets very busy because you're auditing public companies, and that their audit needs to be done by March 31st. And so in order to get the right talent at the right price and move quickly, you really have to get those auditors lined up by March and April to get something. It becomes almost impossible and or even more burdensome from a financial perspective. So amongst all the other things we're talking about, a longer deadline to still meet all the requirements that we're talking about would go a long way, because those prices that we were quoting earlier of 10,000, 30,000, it can easily go to 40 or 50,000 when you're talking about multiple layers of review, people that don't know the healthcare community. It gets very expensive very, very quickly. So that was the only other add back I'd point to.
Good point.
Okay.
Yeah, Todd, I would love to work with you on that. I would just sort of add, the thought around if the filing year end deadline is even at the half year, and then the back end of the year, these folks could do that type of work. You're entirely right. It keeps it out of what folks traditionally call their busy season, which is the first quarter of the year. It could absolutely bring the cost of this type of work down as well. Yeah.
Okay.
And that is something we're working. That is one of our asks of
That's smart.
Consumer Affairs, that it doesn't make sense that it's July 1st for a variety of reasons, including the fact that it's going to cost more money. So thank you. We'll definitely put that in the bill draft. And then very quickly, Andrew, if you wanted to say a few words.
I think it's
Actually,
Edie.
it's Edie that's speaking now.
Yeah, it's me,
Oh, I'm
Nancy.
sorry about that.
That's okay. Hi, everyone. I'm Edie Shapiro, and I am the owner of a Comfort Keeper franchise. We are a healthcare service home. I'm located in Secaucus, New Jersey. And thanks, everyone, for your time and understanding. We are, like many of our members, operate solely on a private pay basis. We do not accept any Medicaid personal care assistance. We understand, as it's been expressed by Sal, how important it is for you to understand where the money goes, but we don't accept any of that money, okay? I'm going to just sort of condense everything a bit. We, as a private pay-only agency, we operate without the support of government funding. We are entirely self-sustained. For agency like ours, the cost and onerous administrative capacity for compliance with these rules can be disproportionate and create an unnecessary financial burden. Again, since we do not accept any government funds, okay? I believe, as do many of our members, all of our members in our home care association, that adding an additional tier for private pay firms within the existing system, requiring only the submission of our financial statement, would support financial transparency without penalizing agencies that do not rely on Medicaid funds. Such a provision would not compromise the integrity of financial transparency, but would create a fairer and more sustainable compliance landscape for non-Medicaid providers, especially smaller agencies that lack the infrastructure of larger publicly funded organizations. Thanks for the opportunity to share this perspective, and I look forward to collaborating and moving this in the direction that's going to really be better for everyone involved. Thank you so much.
Thanks, Edie. So any questions on the audit whatsoever, or any comments from the sponsors, the co-chairs, besides what was said? Because otherwise we'll just move on over to our next important topic. But I want to let anybody weigh in if they'd like. All right, perfect. The next big topic, this I think most of the co-chairs and legislators on the call will be more familiar with this bill, the Domestic Workers Bill of Rights. It is a bill that many of the people on this call worked very closely to talk to many legislators about our concerns with the Domestic Workers Bill of Rights. First and foremost, that we do not, our home health aides are not domestic workers and they should not be part of the bill. So that was our premise, number one. And then when we were still put in the bill, we tried to work to make sure that it was the least onerous for our providers. With that said, of course, the bill passed. Again, some of the most onerous parts for us were taken out, but it still is a very challenging bill to implement. With that said, we were going to have Sal give another quick overview, and then we'll start that discussion.
Sure, just to sort of level set, and this, you all will remember this law was passed in the last few days of the last legislative term. So the law was signed by Governor Murphy in January, give or take, earlier this year. Regulations like the previous topic have not yet come out. We've had, as an association, multiple meetings with the Division of Labor and the Department of Labor and Workforce Development. And this issue will also be a topic at our meeting with Consumer Affairs, which Nancy referenced earlier. What's interesting, and by the way, right, so you guys know how government works better than any of us. When we met with the Department of Labor, they did not know that healthcare service firms are separately licensed and regulated under the Division of Consumer Affairs. Similarly, they did not know that certified home health aides are regulated and licensed under the Board of Nursing through the Division of Consumer Affairs. So this begs the very initial question of, this law was intended, we believe, and properly so, to protect vulnerable workers who, what I guess we can all ask what our definition of a domestic worker is. We might get, there's 50 people, you might get 30 or 40 or 50 different definitions. This law covers, as a domestic worker, any individual who works in a residence for the purpose of ... serving as a companion or caretaker for a sick or convalescing or elderly person. It also includes, similarly, gardeners, valet drivers, people who park cars, cleaning people, gardening people, personal organizing, butlers, and people who provide food. All important jobs, obviously, but none, I don't think, are licensed like certified home health aides, and none who work for entities that are licensed like healthcare service firms. So we feel as an industry that we're, a round peg in a square hole on this particular one. And the sponsors would not, it was lame duck. You all know how hectic those discussions could be. So be that as it may, we are tasked with having to comply with this law. By the way, healthcare service firms have comply with all the federal laws, and if they don't, they're brought to task by the Department of Labor, whether it's overtime, unemployment, wage and hour requirements. None of that has changed, obviously. But a couple things that we wanted to raise for you that are concerning here. So the home care industry is not opposed to workers having the protections, obviously. Our employees typically are highly regulated and independently licensed by the Board of Nursing. One of the sort of overlaps here, right? Because now you have the Department of Labor enforcing domestic workers law, and you have the Division of Consumer Affairs regulating the firms and the employees who are professionals. One of the requirements under this law is that a domestic worker can, on its own, on his or her own, decide to, not abide by an agreement to take paid working lunch or working mealtime or rest time. So that's a protection for the domestic worker, right? If they have a patient who is convalescing, elderly, what have you, and they can't just leave and take a break, it is understood contractually that the worker has to stay with that patient. But the law similarly allows them, or gives the worker the right to unilaterally break that contract. Okay, fine. We all get sick and call out from work sometimes, but that's not this situation. This situation is where the firm has a worker who's with a patient who needs care, a lot of care, and the worker has the right to walk away under the domestic workers law. Okay, fine. Two problems. The first is that the worker is regulated as a healthcare certified home health aide and exercising their rights under this law may constitute abandonment under the license of a certified home health aide, right? If so, that's one thing. So in that respect, sort of jeopardizes the employee. The other way of looking at it is under the domestic workers law, nobody can report or take an adverse job action against an employee who is exercising their rights under the law. As a result, and that conflicts with the Cullen law. I know Assemblywoman Munoz is likely familiar with the Cullen law as a nurse, and that requires someone to speak up when they see a licensed professional doing something adverse to a patient, such as abandonment. So I don't, you guys know me well enough to know I don't like to lobby by saying the sky is falling. I don't do Chicken Little type of things, but this is a real conflict where a healthcare service firm cannot reprimand or take an action against an employee who has a unilateral right to break a contract. It doesn't really add up. Again, these are licensed employees, licensed by the Board of Nursing, and they shouldn't be having the right to walk away from a patient who needs their care. So that's, I think, one of the high-level concerns that we have. The other is just the contractual obligation, which, again, this work is dynamic. Patients' conditions change. Their working locations sometimes change for the employees. The obligation of having a contract in place becomes somewhat burdensome, particularly when the employees do not work in an office, but they're out in the field. So somewhat of a complicated dynamic there. We've reported all this to the Department of Labor, and hopefully regulations will sort of meld the Division of Consumer Affairs and the Department of Labor obligations. One other thing that I'll raise as a high-level concern is the very broad, I will say, prophylactic definitions in the law of who is covered. There's definition of an employment agency. An employment agency is different than a referral agency, and that's different than a hiring entity. So you have these three different definitions in the law, and it's not entirely clear where a healthcare service firm falls, or quite frankly, where the family of a patient might fall. We think that they're the hiring entity, but if they're the hiring entity, then the healthcare service firm isn't. So a little uncertainty there. We raised that with the department, but the department's response was, well, it doesn't much matter because there's joint and several liability for any violations. So that means joint and several liability, right, means that everyone's going to be assessed for any violations. That includes the family who's hiring, the family of the patient. That includes a healthcare service firm as well. So a very broad and prophylactic law that, again, we feel we're the round peg in a square hole on. So I don't know what the action item is here. It's certainly a well-intended law, and there certainly are workers who need these protections. We would say, hey, you know what? Licensed workers who have to pass background checks, get 76 hours of training, have to be American citizens. They are probably not those workers who are the most vulnerable, but be that as it may, we are raising these flags now, and hopefully, the regulations provide some relief. We'll see where that goes. Back to you, Nancy.
Thank you, Sal. Any questions from anyone before we ask our first speaker to join? All right,
Nope.
thank you. Michael.
I'm here. Hi.
How are you?
Good morning. My name is Michael Mangano, and I live in Landing, New Jersey, up in Morris County. A couple of years ago, my father, age 95, was living alone independently. He had a long-time diagnosis of diabetes with neuropathy in his hands and feet, poor eyesight due to macular degeneration, and was dealing with debilitating fatigue. He could no longer drive and needed support with his self-care and his mobility. It was clear that he required more care, but my brothers and sisters and I had made a promise to my father years before that he would age in a place in the home he'd known for many years. After carefully researching our options, we decided on bringing in a professional caregiver to provide in-home care services. We chose Home Instead Senior Care in Morris County. Selecting a licensed and accredited New Jersey healthcare service firm was one of the most important decisions that we've made. Healthcare service firms are licensed by the New Jersey Division of Consumer Affairs and hire certified home health aides who are licensed by the New Jersey Board of Nursing. Licensed agencies offer a level of professionalism, accountability, and reliability that is crucial when entrusting the care of a loved one to someone else. The agency managed all the scheduling for their caregivers, and we felt confident knowing that the caregivers were trained, thoroughly vetted, and supervised by an RN and held to strict standards by both the state of New Jersey and the agency. This ensured that my dad received the compassionate and competent care that he needed, while my family and I had peace of mind. However, we also learned firsthand the financial strain that home care places on families, especially those in a sandwich generation. People like me who are simultaneously caring for aging parents while supporting my own children and paying for their college expenses. Middle-class families face the growing challenge of balancing care without exhausting their savings or compromising the well-being of their loved ones. This is why it is so important that the state avoids over-regulating the home care industry. While regulations are necessary to ensure safety and quality, excessive regulations often drive up costs, make getting care less affordable for families like mine. These increased costs inevitably get passed on to families, pushing quality care out of reach for many middle-class households like myself. We need a balanced approach, one that promotes safety and high standards without imposing excessive financial burdens on their families. The state must prioritize keeping home care affordable for middle-class families while allowing agencies to continue providing the essential services that many depend on. My father's caregivers made a tremendous difference in his daily life, providing the companionship, personal care, safety, and support that allowed him to maintain his dignity and independence. Home Instead services were a lifesaver for our family, knowing that our dad was receiving the attention he needed while we managed the demands of balancing work and providing for my wife and children. Sadly, my dad recently passed away at the age of 98, but knowing that he upheld my promise to keep him at home for as long as it was possible, surrounded by familiar comforts, is invaluable. Home care is a lifeline for families like mine, and we need to ensure that it remains accessible and affordable for everyone. Thank you for your time.
Thank you, Michael. I appreciate it. Any questions before we move on to our last speaker on the topic?
Just want to thank Michael for this, for what he's put out there. Thank you, Michael, for that presentation.
Agreed.
Thank you.
Thank you. Okay, Gimber, if you want to unmute yourself.
Hi, good morning, everyone. My name is Gimber Hernandez. I am the owner of Always Best Care of Princeton. I've been in service for now 10 years with my wife. And the topic I want to talk about is the domestic bill of rights, how it's impacting us. I can share that my mother was a single mother raising 3 children, and she had multiple jobs. So I think uniquely, as many of us, I can express that it's very important to have rights that protect workers such as my mother. But as Sal and others mentioned, there's a great impact to our industry when we are already regulatory and legally bound by so much regulations. So I just to be brief, I would ask everyone here to be cognizant of the importance of the law, but also the impact to our industry. Thank you very much.
Thank you, Gimbert. Everyone listened and testified in a really short amount of time, so I appreciate that all. We were trying to be very mindful of time this time. So really, to wrap up, I think, as Sal has mentioned, we have worked extensively with the Department of Labor. When I know I hosted my conference, I had Deputy Commissioner Julie Diaz come and speak about the law and the proposed regs. That was back in June. The bill was passed quite a bit ago. We still don't have regs. They said it could take up to a year, so we are kind of working in limbo. Really, I think our ask is that you continue to kind of walk this journey with us. We are trying to make it, again, as we said, as palatable as humanly possible for our agencies, so that way it does not unduly burden them. The contract is the perfect example, and Sal had mentioned that. It is not a contract. If you have a housekeeper, it is a pretty simple, straightforward contract. It is the hours they work, the salary that they have, plus some extra things. For home health aide, that is very different. They work for multiple people. That changes very often. The pay rate changes depending upon whether it's insurance, private pay, Medicaid. The hours change. Their duties change. So many things are different for a home health aide than they are for the typical domestic worker that this bill was trying to protect. Sorry, Senator Johnson, go ahead.
No, I'm agreeing. Go ahead.
Oh, yeah. So, and again, we've asked the Department of Labor to take all of this into consideration. As Sal mentioned, I don't think they really understood what a healthcare service firm did or does. And we've laid out all of the things that we kind of follow, and in the hopes that when they promulgate these regulations, they are the least burdensome as possible. Something that I think Sal touched on a little bit is, one of the provisions of the bill was that originally was that an aide was allowed to leave for lunch, because again, a gardener, a housekeeper, those types of folks would be able to leave for lunch. And we had said that's not possible in a home care. Many, many times it is the aide and the patient that they are taking care of. So they put the provision in that it's an on-duty meal and rest break, but that they could rescind that at any time. So if they decided that they don't want to do that anymore, they can tell us, no, we want to leave for our lunch, which again would put our patients at risk, and there'd be no way for us to run an aide over for that half-hour lunch break. So while we got it carved out that we could at least have an on duty, and it's not just us, nannies would be the same thing, that we have to actually be physically present. Yes, of course, all aides should be able to take their lunch, by themselves, right? Like they are off the clock in the sense that they are still physically present, but should be able to make phone calls and do whatever they want to do during their lunch period. But the understanding has always been you still have your eye out for the patient, because again, God forbid they fall or they hurt themselves, you are in the home taking care of them. And so there's still some ambiguity, and we're waiting for the regulations to come in. We're waiting for the draft regulations to come out to see what it says about it. But that's just kind of one example of things that we tried to make the legislation as palatable as possible, but we still have concerns with. Any questions from our legislators or anything that I missed on that?
I'll defer to Assemblywoman Munoz.
Thank you. Now, I think this has been, really helpful because, as I said previously, earlier in this call, and many of you have heard me say it, those of you who have known me a long time, the unintended consequences sometimes we don't know about, but we can help work with you to to correct it. So we're happy to do that.
Thank you, Assemblywoman.
Thank you.
Thank you.
I'll defer to Assemblywoman Murphy too. I'm deferring today.
Well, we were hoping to refer to you, Senator, but no, I agree with the Assemblywoman and the Senator that, that we, the chairs that are for the caucus. We're here because we want to support what you need to get done. And I agree with the unintended consequences. We have to ensure that we address them. But one of the things, and those who have heard me say this as well, in the same long lines as Assemblywoman Munoz, is that, you know, we pass legislation and sometimes we forget to go back and see how it's working. And sometimes we do have to do that. And this is one of those pieces of legislation or update laws, right? Those are things we have to focus a little bit more on, making sure that when we do pass legislation or we have pending legislation, that it is beneficial to everyone who it's intended to. So that's what we're about here. And I do appreciate being included. Thank you.
So the only, I guess the last comment I'll make, and appreciate your thoughts on it all, is that the square peg round hole analogy applies here when the domestic worker definition captures professionals who are licensed and highly regulated and trained and background checked professionals. So again, the question for you policymakers and legislators is, you know, domestic workers do require, you know, protections in the workplace. Are licensed professionals domestic workers? And that's the question, I think, here, because that's where we run up against the conflict between what Department of Labor has to do and what the Division of Consumer Affairs has to do.
Okay.
Thank you.
Thank you. And so we're basically at time. The only other thing I was going to say is I was just going to bring it back to our original discussion on September 24th, and that was about the nurse shortage. So as we continue to do our research, if there's anything that you are looking for, so we spend a lot of time looking at data on the aide shortage and the nurse shortage. We actually asked some of our families, the two families that you heard from were both receiving private duty nursing. And so that kind of group of families, we had asked them to do a survey on how often you're missing shifts. Like, how often can you not go to work? Can your child not go to school because of the nurse shortage? So we're gonna share that information with you when we next meet. But if there's anything in particular that you are looking for, we are happy to gather that data in the intervening months. And then lastly, a bit of housekeeping. Our question would be, we were thinking about having our next meeting in January. So I will just leave it for you guys to think about whether you want to do an in-person meeting or if you want to continue with Zoom. So those would be the two kind of housekeeping pieces. Andrea, anything else that I missed or any last minute? I mean, we're going to end 2 minutes early, so we did better than we did our last time. But I think
group, that's good.
Yeah, well, and I think we kept it smaller topics, right? Like, I think we can only handle so many topics at one time.
Very efficient.
I just have to opine that I actually really like the Zoom meetings, and because it gives us more flexibility. And also, when you think about January, we could be up against some bad weather. You never know. So because of our busy schedules, being able to do a Zoom meeting and fit it in and still, you know, it really works for me. I can't speak for the other legislators, but for me, it does. It works really well.
Sure.
And for me, I can go either way, Zoom or in person, but
Yes.
I like Zoom. I go with Zoom.
Yeah.
Well, same here. Whatever's convenient for you guys. I'm good.
Yeah.
Okay. Yeah. Well, I was thinking the same thing as the Assemblywoman about the weather, that I don't want to host it, have all these people come and then have us hit really bad weather. So maybe we'll do the next one in Zoom. And then I would love to meet at some time in person. So maybe in the spring we could try to meet in person, but I tend to agree the weather could definitely be challenging. So I'll work with your offices on next availability in January.
Yeah, we can meet on the chamber train. That'd be great.
There you go. There you go.
Good idea.
We're in.
There you go.
All right. Any last minute comments from any legislators before we let you go for the day?
No, just
thank you very much. It's really informative. Thank you.
Thank you very much for attending, everybody. Have a wonderful day.
Yes. Thank you, everybody.
Thank you.
Bye. Take care.